You ever get your HESI scores back or your ATI exam and you're like, how in the world did I get that question wrong? What was I thinking? Well, I'm here to help you today as we're going to go over some NCLEX questions to prepare you for prioritization and delegation, which is a huge piece of the NCLEX exam. All right, here we go. We got a nurse assessing a 39-year-old Caucasian female client. The client has a BP of 152/92 at rest and a total cholesterol of 190. A fasting blood glucose of 110. The nurse would place the priority on which factor for coronary heart disease in this client. We have A is age, B is hypertension, C is hyperlipidemia, and D is glucose intolerance. So which of one of those can we kind of correlate to coronary artery disease? All right, so the correct answer on this one is actually B, and that is hypertension. So as we know, hypertension, cigarette smoking, hyperlipidemia are all factors of CAD, right? Glucose intolerance, obesity, and response to stress are also factors. But if we look at our answers here, age can be a risk factor too, but it's a non-modifiable. So we can't inject them with some serum to make them younger. So we can't really focus on their age. Hyperlipidemia, 190 is within normal range, so we can't focus on that. Glucose intolerance, 110 is, right in range. It might be a little bit high, more in the pre-diabetic type range, but it's still in the good range. So the one that we really can focus on is hypertension, because 152/92 is classified as hypertensive. So that is the factor that we're going to consider as our priority in this situation. Okay. A labor room nurse is caring for a client with a known history of sickle cell anemia. Which priority action would the nurse implement to assist in preventing a sickle cell crisis from occurring during labor? So we have A, continually reassure the coach the client. B, administer prescribed oxygen throughout labor. C, maintain strict asepsis throughout the labor process. D, increase the intravenous fluids if the client complains that they're thirsty. So again, what is our priority here? What can we do to help prevent that sickle cell crisis? It's a little more challenging, but hopefully you got it. Its answer is B, administer the prescribed oxygen throughout labor. Why? They're at risk for not having enough oxygen due to that sickle cell. So that's the one that we're gonna focus on. A and C, yeah, those are things that we're gonna do to our labor patients, absolutely. But those are just common for all labor patients, not someone who has sickle cell. Okay, D, increase the IV fluids. If there's a hydration status issue, we can do that, but we can't do that on our own. We obviously have to have an MD's order for that, so that would not be a correct answer. So it's gonna be B, administer the prescribed oxygen throughout labor. All right, here we're the nurse and we're caring for a patient who has bilateral wrist restraints. Which nursing intervention would receive the highest priority regarding these wrist restraints? So our options include A, providing range of motion exercise to the wrists. B, removing the restraints periodically per agency guidelines. C, applying lotion to the skin underneath those restraints. Or D, assessing the color, sensation, and pulses distal to that of the restraints. Your priority intervention here with the patient with restraints is D. I know you got that one right. You did. Right? Of course, restraints are last resort for our patients, but we have to assess for color, sensation, pulses distal to the restraints to make sure there's no neurovascular compromises. Our restraints are too tight or anything of that nature. The other ones are appropriate things that we would do again as a nurse, but the priority is check for their CSM, sensation, circulation, and movement. All right, here's a good question, right? We have a registered nurse has delegated the care of a newly post-operative client to an LPN. The LPN notifies the RN that the client's blood pressure and respirations are both going to be elevated from the baseline, and the client is complaining of pain and dyspnea or shortness of breath. The RN takes which action next? A, the RN need not to carry out further assessments because the LPN is experienced and trustworthy. B, the RN requests that the LPN offer the client an opioid analgesic, which has been post-operatively ordered. C, the RN places a call to the attending surgeon and reports that the client is having pain and shortness of breath. D, the RN assesses the client, checks the client's surgical notes, and then gathers data before calling the surgeon. So what would you do if you're the RN in this situation? Because you'll probably have the situation when you are a nurse. So you need to know. And I know you do. And the answer is D. You are going to assess the client and check the surgical notes and then gather the appropriate information before you make a call to the surgeon, right? So the nurse has to do their own assessment on that patient. Even though you probably maybe trust that LPN, that's great, but you need to go in and do your own assessment on that. A pain medication might help, might lower that blood pressure, but again, it's going to cause potentially respiratory distress. So you might not want to be giving a pain medication to someone who's already having respiratory distress. So again, you got to go assess. So you wouldn't just tell the LPN to go do that. And then you're not going to call the surgeon unless you've gone in and assessed it. So that rules out C. So again, the answer is D. You got to go in, assess the client, look at the notes, and then gather information before you call the surgeon to update them on this patient. We have a prima gravidia is admitted to the labor unit. During the assessment of the client, her membranes rupture spontaneously. The priority nursing action is which of the following? A, monitor the contraction pattern. B, assess the fetal heart rate. C, note the amount, color, and odor of the amniotic fluid. D, check the maternal vital signs. So what are you going to do if this membrane suddenly rupture? You are going to do B, assess the fetal heart rate. All right, so when membranes rupture in the birth setting, you're immediately going to check the fetal heart rate to detect any changes associated with prolapse or maybe a compression of that umbilical cord. So options A, C, and D, right? Maybe a component of care, but again, they're not going to be the priority action. The priority action is B, do that fetal heart rate. We have another labor question here. So you're assigned to care for a client in labor and will care for the client throughout labor into postpartum. The nurse assists in developing a plan of care and determines the priority assessment in the fourth stage of labor is which of the following? A, assessing the uterine, the fundus, and the lochia. B, checking the mother's temperature. C, encouraging food and fluid intake. D, providing privacy for the parents and their newborn infant. Okay, the answer is A. The fourth stage of labor is a stage of physical recovery for the mother, newborn, and the infant. It lasts from the delivery of the placenta through the 1 to 4 hours. So a potential complication following delivery is hemorrhage, so the most significant source of bleeding on the site where the placenta is implanted. It is critical that the uterus remain contracted and that the vaginal blood flow is monitored every 15 minutes for the first 1 to 2 hours. Although options B, C, and D are also interventions that you'd probably be doing during this stage, but again, they're not the priority for this question. The answer is A. All right, here we have a client who's brought to the emergency department by the police after having lacerated both wrists in a suicide attempt. The nurse should take which initial action? A, examine and treat the wound sites. B, obtain and record a detailed history. C, encourage and assist the client to ventilate the feelings. D, administer an anti-anxiety agent. So what would we do first upon receiving this client? A, the client has a physiological injury, okay, and the nurse would initially examine and treat the wound sites because of bleeding. So although B, C, and D are appropriate for this client, clearly, at some point, the initial action would be to treat those wounds first. Again, airway, breathing, circulation, I mentioned that lots of times. What are we talking about here? Circulation. If they're actively bleeding, we got to treat that first.